Hello everyone and welcome to Retina Connect. And in our last video, we looked at the symptoms of diabetic retinopathy. Now, a common question is, what are the relevant and appropriate tests that one needs to undergo for the evaluation of diabetic retinopathy? First is, you need to have a complete eye examination including visual acuity and, more importantly, pupil-dilated retinal examination, which the ophthalmologist or retina specialist will be able to do. You need to instill the eye drops, dilate the pupil over 20 minutes and have a retinal examination. So that is the basic test to be done. So there are simple tests, the retinal imaging tests that are non-invasive, without side effect or any discomfort to the eye, which can be repeated each visit that you make to the retinal specialist. For example, the most common test currently done is OCT or Optical Coherence Tomography scan. That can, whether it be a yearly checkup or 6-monthly or 3-monthly, OCT scans are very simple, and it picks up the macular edema, which is the usual culprit causing a mild decrease in vision in people even in the early stages of diabetic retinopathy. So even the mildest macular edema can be picked up with this OCT scan, which is available now in most of the centers. Another test that is very simple and can be repeated without any side effect or discomfort to the eye is something called fundus photograph or the retinal photograph, which is a digital photo of the retina which shows any hemorrhages or any other findings, helping the specialist to precisely see what stage of retinopathy it is, whether it's early or late, and then give the appropriate treatments. So these are very simple tests and may need to be repeated during the follow-up visits as well to compare to the previous for a documentation also. There are advanced tests like fluorescein angiography, which needs a dye injection to the arm and then take photos in the eye. But that is an invasive test and is not required for everybody, and it is mostly in the late stages of the disease or in any special situations where the doctor decides that this particular person requires a fluorescein angiography. That is limited only to certain people. So only if it is very much required. So these are the newer investigations which even with a examination by a retina specialist may miss, but these tests is more precise, and imaging helps in early diagnosis, which is very important in diabetic retinopathy. So thank you for watching and your attention. See you in the next video.